Immunotherapy is approved for platinum refractory disease, that is patients who progress after receiving cisplatin or carboplatin. And this trial, Javelin 100, which looked at maintenance immunotherapy with avelumab, actually is a novel trial where the concept of switch maintenance was tested. That is, patients who have a response or stable disease after first line platinum therapy. And we also did a trial with pembrolizumab as a part of the Hoosier Network study led by Dr. Matt Galsky, where we used pembrolizumab as a switch maintenance strategy. So the whole concept is to, instead of putting patients on surveillance, that is those who respond to platinums or have stable disease, after 6 cycles or so, we don't treat them until they progress. But as a part of these studies, patients received immunotherapy early on so that we wanted to see if these patients' outcomes are improved. And the data from the Javelin 100 showed that patients who received immunotherapy maintenance as opposed to best supportive care had a remarkably improved overall survival and progression-free survival. And looking at the data from platinum refractory setting with immunotherapy, it appears that the earlier use of immunotherapy is better because we are not missing out on patients who may lose out on getting immunotherapy also.
Javelin Bladder 100 was a multi-center international phase 3 randomized trial of metastatic urothelial cancer patients who received chemotherapy. So they received 4 to 6 cycles of platinum-based chemotherapy. So that could either have been gemcitabine or cisplatin or carboplatin with gemcitabine combination. Now, they should have achieved either complete response, partial response, or stable disease. So if they progress on the chemotherapy regimens, they would not have been allowed to get randomized. And the randomization arm was either maintenance avelumab versus best supportive care. Now, avelumab was given 10 milligram per kilogram every 2 weeks, and there was no cap, no limit to how long they were going to get it for. So until, toxicity perhaps or progressive disease, they continued on with the treatment. The primary endpoint was overall survival in both the primary analysis as well as the PD-L1 population of patients. I think the population of Javelin Bladder 100 is really contemporary and relevant in clinical practice. Most patients, let's say, who have completed or are able to complete chemotherapy are often wiped out. And remember too that our bladder cancer patient population tends to be in the elderly population. So by the time they get 4 to 6 cycles of chemotherapy, even though they have good response, a lot of them are having the side effects from chemotherapy. In addition, a lot of them may progress after finishing chemotherapy. So a treatment that may be able to consolidate that response is pretty much well received. And this is the setting really of Javelin Bladder 100, and that's how we are able to translate it into real world practice. So I think being able to maintain them on a certain treatment regimen that hopefully has non-overlapping effects with chemotherapy is really ideal. And this is where the switch maintenance approach would really be useful in this population of patients.